I'm Claire Saxton, Director of Education with the Cancer Support Community. Welcome to our webinar, Frankly Speaking About Cancer, Tips for Reducing Your Cost of Care, hosted by the Cancer Support Community. If you need technical assistance during this webinar, please dial 1-866-229-3239 and then dial option number 1. Before we start, I'll go over some reminders and housekeeping items. If you would like to listen to today's presentation via telephone, please dial in using the conference line code you see on this screen. Today's call is being recorded and will be available on our website at www.cancersupportcommunity.org/webinars within the next few days. The format of today's webinar will be as follows. The panelists will present first, and then we will open the discussion up to the audience during the question and answer session. Thank you to those who submitted questions prior to the webinar as part of the registration form. If you would like to ask additional questions, please feel free to type it into the Q&A box on the right of your screen. You may submit a question at any time during this event. At the end of this webinar, you will automatically be redirected to the post-webinar survey. Please take a few minutes to complete this survey as your input helps us improve future webinars. I would now like to introduce the Cancer Support Community, which is the largest professionally led nonprofit network of cancer support worldwide. CSC is dedicated to ensuring that all people impacted by cancer are empowered by knowledge, strengthened by action, and sustained by the community. We offer the highest quality social and emotional support through our affiliate network, as well as online or over the phone. On this screen, you'll see some of the resources we provide at the Cancer Support Community. The first one there is the Cancer Support Helpline, which is staffed by licensed professional counselors who are available to assist you Monday through Friday, 9 a.m. to 9 p.m. Eastern Time. We also have our Open to Options program, which is a research-proven program that can help you prepare a list of questions to share with your doctor. We also have our Frankly Speaking About Cancer program, which is CSC's landmark education series that provides trusted information on a variety of topics important to people affected by cancer. Information is available through print and digital publications, online and in-person programs. For the complete list of publications, please visit orders.cancersupportcommunity.org. I would also like to introduce our Cancer Experience Registry, which is a unique project for people affected by cancer. People who have been diagnosed with cancer and those who help care for them can join the registry. You begin by answering survey questions. Your answers and those of others describe the experience of cancer patients and caregivers. This information is used to provide education and support resources that speak to patients, caregivers, and their needs. For more information or to join, visit www.cancerexperienceregistry.org. I would like to take a moment to talk about our grassroots movement, which helps ensure that people touched by cancer have access to quality, comprehensive cancer care that includes social and emotional support. Again, if you would like to learn more about this program or to sign up, visit our website at www.cancersupportcommunity.org/join-our-movement. I would now like to introduce our panelists, Amanda Holt and Dawn Holcombe. Amanda Holt has over 8 years of experience assisting patients with insurance optimization and advocating for alternative funding for treatments. Since June 2014, she has worked as the financial navigator and certified application counselor for Maury Regional Medical Center. In addition to her position at Maury Regional, in April of 2016, she decided to take her passion for patient advocacy to the next level by becoming the financial specialist consultant for the Cancer Support Community. Dawn Holcombe has over 30 years of experience in healthcare, including executive, strategic, financial, and marketing positions in academic and private health systems, as well as physician practices. Dawn serves as the executive director for the Connecticut Oncology Association. She is a fellow in the American College of Medical Practice Executives, earning her MBA at the University of Michigan. So Cancer Support Community's Cancer Experience Registry found that 58% of the patients who responded listed financial worries or lack of health insurance coverage as one of the leading sources of their cancer-related distress. Tonight's webinar will provide you with tips for managing the cost of cancer care. Amanda will start us off by discussing potential expenses with cancer treatment and important terms that you should know. Amanda?
Thank you so much, Claire. I'm so glad to be speaking with you tonight on such an important topic. Cancer care is expensive. Cancer treatment may range a few months to a few years. The diagnosis is a journey in itself. Cancer treatment can include provider and clinic visits, procedures and surgeries, medications, both from symptom management meds, maybe chronic illnesses you may already experience from, chemo. It could be a variety of things, as some of you may know. Lab and imaging tests, hospital stays and emergency department visits, home care, rehabilitation care, durable medical equipment, hospice care, palliative care. Some of the important terms to remember and to know about your insurance would be to start your premium. The amount a person or company pays each month to maintain insurance coverage. There are various ways you may pay your premiums through your employer, through your Social Security check, or you might even be billed for the premiums. Co-payments, it's a dollar amount set by your insurance provider required to be paid by a patient each time care is received. Typically, you can pay a copay at the time you see your doctor. This could be different depending on your insurance rules. Some copays may be for x-rays or scans. Again, it just depends on your insurance. Your deductible is a term that's used for approved healthcare costs. An insured patient must pay out of pocket on an insurance claim before health care begins paying any cost. So they'll share this cost with you at this point. That cost is called your coinsurance. That's your portion of the cost sharing. Your out-of-pocket is the total amount of cost you pay not covered particularly by your insurance, includes deductibles, your coinsurance, and the cost that you share with your insurance. Some of other important terms to remember is your explanation of benefits. You'll most commonly hear that referred to as your EOB for short. It's a document that outlines what portion of the provider's charges are eligible for benefits under your insurance plan. An EOB is not a bill, but it explains what's covered by insurance. Your provider may bill you separately for any charges you're still responsible for. An explanation of benefits also explains if there may be any issues with your coverage, if there was something that was not covered by the services that were rendered. So very important to show and keep up with, and you can match these with the bills that you received from your providers. And moving on to know your treatment plan and diagnosis. Dawn?
Yes, I did want to add one thing. If we could go back to slide 10. I just want to make sure that we shared with people on the webinar that what we're addressing here is the cost of care for people with insurance, Medicare, Medicaid, or other coverage. So if you do not have insurance, you can call the Cancer Support Helpline, which is 888-793-9355, to find coverage options. And so now we'll move back to slide 13.
Thank you, Dawn.
Okay, thank you. So one of the biggest tips that you can do to help manage your costs is to understand your treatment plan and your diagnosis. These are conversations that you can have with your physician, and they will be able to identify for you what kind of treatment you're going to have. So ask them, what is my cancer diagnosis? What is the plan? What medications am I going to be receiving, and what frequency? How often will I be coming in? This is some of the information that you're going to need to know to anticipate some of the costs that we're going to talk about later. You may have personal costs of, and I'll jump the gun, of transportation or caring for children or caring for senior people while you're in the middle of treatment. So understanding the frequency of your treatment plan, whether it's going to be once a week, 3 times a week, 1 week on, 4 weeks off, 4 weeks on, 1 week off, 3 weeks on, 1 week off. That is the treatment plan. So ask what your diagnosis is and ask what your plan is. Ask what the drugs are that you are receiving, the names of the drugs. Write down your full name and the stage of your cancer diagnosis. Cancer diagnoses are staged in stage 1, stage 2, stage 3, stage 4. Sometimes the doctor may not know it at the moment that you're speaking with them, because sometimes they need to do some diagnostic tests in order to determine exactly what the stage of your particular diagnosis would be called. So don't be surprised if they don't know it right away, but at some point it will be known, and that will be an important piece of information for you to keep track of. Ask them what treatment you're going to receive. You probably will receive treatment in other offices besides your oncologist office. You may need surgery, you may need radiation therapy, chemotherapy, or targeted therapy, immunotherapy. The last 3 are types of treatments and that you are most likely to receive in the oncology office, but you may have oral medications that you're taking as well, and they may be in combination with some of the other treatments that you are receiving. So you're going to want to keep an eye on that and keep it written down. You may not want to handle this all yourself. It is perfectly fine to bring a family member or a friend to your office visits. Particularly with your doctor, they can help you record even bring a recording, bring a tape recorder, record the discussion, and or just take notes. They could help you with that. Sometimes this is a very scary time, and it may be hard for you to catch up and to process. So having somebody beside you to keep track of the information that's coming at you could be very useful. And then when you get home, review the information that the healthcare team gives you. They will give you so much support material. They will give you books. They will give you papers. Take a look at that, and that will help you understand better what you're facing. And you can take a look at that. You can take it with you and take a look at it after you've left the office. The next slide. One of the best ways for you to feel control over your cancer is to be engaged. Part of engagement is that you feel that you have the right to ask questions, and you do have the right to ask questions. These are some of the questions that you might be likely to want to ask. You may not want to ask them all at once. Some of these will come in at different points in your treatment and in the journey that you're going to have with your cancer diagnosis. So this is the kind of information, and we have some materials through the cancer support community that you can take with you to help you remember these questions. But some of the ones that are very important to ask, and don't be afraid to, is what is my diagnosis? What is this? What is this meaning that there's an abnormal test? What does it mean? Is my cancer treatable? If it is, what are the treatment options? What is the goal? What are we trying to accomplish? Are we trying to make my cancer better? Are we trying to manage my symptoms during the time that I'm dealing with this cancer? Or are we just trying to make me comfortable as I go through the process, that perhaps the cancer is not going to be curable? So the question is, what are my options? What is my goal? How sick will I be? And that is a precursor to what kind of things that I was doing last year that I may or may not be able to do this year. And they may be temporary changes, or they may be more lasting adjustments. But it's very important that you understand what you're going to face, because the unknown is far more scary than the known. If the doctor is able to tell you, or the nurse, that in 3 days you are going to feel this way, you'll be prepared. It won't take you off guard, and then you'll be better able to manage it. A lot of times people may not anticipate what some of the symptoms and side effects are going to be, and when they happen, they may turn to the emergency department. And unfortunately, there is a good likelihood that if you go to the emergency department, you may get admitted. And it may be that these costs are being added to your care when they could have been managed very effectively if you had known and anticipated that they were coming and called the doctor's office, and they would have made arrangements to get you the help that you needed or the guidance that you needed, perhaps without the cost of an ER visit or a hospitalization. Another question to ask is, what can I do and what can't I do? If you have kids, if you have work, if you have older members of your family that you're responsible for, are you going to be able to continue to read, write, cook, sing, play the piano, a lot of different things? Sometimes there can be changes in the feeling of your fingertips, and it's important to anticipate those and know how they may change your patterns of daily living. Another question that's very fair to ask is, am I going to be able to keep working, and for how long? This is a very important question because not only could it affect your income and your family's income, but it could also affect the insurance coverage and benefits that you have and the premiums that you pay, because changes in your work status may end up changing your insurance benefits and status as well. All this is information that you can ask in advance and try to prepare. What is my life going to be like during treatment? Try to understand. There are going to be times when they can tell you, you're not going to feel so good these couple days, or you're going to be very thirsty, you're going to be very dehydrated, you may be disoriented. The more that you can ask and learn and anticipate, the easier it's going to be to get through it. What is your life going to look like after treatment? There is a term for this. It is called survivorship, and there is usually a very focused plan of action for helping patients who are survivors manage the rest of their lives. They don't need to always worry about, is a headache going to be a precursor of cancer coming back? What can you expect? Will there be long-term side effects? Are you going to be able to continue to work after your treatment is finished? Ask for a care plan. This is basically an outline of the treatment, the plan, the expectations that the physician has for you, and what you both should be expecting as you go through the journey. If many physicians have this information available in writing, and if they don't, it's appropriate to ask them whether they can create something for you, because it is fair for you to take something away that you can look at in the afternoon or in the evening when you're at home to make sure that you understand how much on track you are and what to expect in the future. It's also very useful to ask about clinical trials. And if you're not familiar with clinical trials, there are a number of them out in the country. Every one of them has certain exclusion and inclusion criteria. So they have very tight parameters about the type of patients that are appropriate for specific trials. In the parlance of medical treatment, if there is an appropriate clinical trial for you, it is always considered an appropriate course of treatment. Ask your physician if there are options for these trials, or whether they feel that your best opportunity is to continue with the standard of care that is the norm for treatment of your cancer. So it's also important to ask, if you look at a clinical trial option, how might it change the cost of your treatment or your health in comparison to other options? The effect of the treatments that are on clinical trial may be significantly different than the effect of other treatments that are there as an option for you. But there also could be an opportunity where some of the costs of a clinical trial treatment may be covered. So that's another reason to consider the option for a clinical trial. Always keep in mind that you may have to ask permission from your insurance company for anything that's related to your cancer treatment and your diagnosis. They have issued a plan to you, whether it's through an employer or you have it independently, and every plan has different parameters, different types of treatment, perhaps different drugs are on formulary. Different physicians may be in your treatment network or they may not be in the treatment network. So every single time you look at a choice along your cancer treatment continuum, always step back and consider what are the parameters of my insurance plan. It's very easy to call the number on the back of your card and say, I'm just trying to understand this. The more that you know your plan and your treatment options, the easier it will be for you to have that conversation with your insurer. But just know also that your physician office is also there with you and is going to be following the treatment coverage and the limits and the opportunities under your health insurance plan quite tightly. May we go on to the next slide? Second tip, number one, don't be afraid to get a second opinion. Sometimes there are 2 or 3 standard treatments for certain types of cancer, and just because one doctor may use one and another doctor may prefer another does not mean that either of them are wrong. They are just different approaches that they tend to take for those cancers. So it's okay to ask around and find out how somebody else might approach your cancer. Don't be afraid to ask each one of them what the costs are going to be. Sometimes the billing costs are higher in one setting, perhaps a hospital-based physician, a physician treatment that is employed by a hospital, than from a physician that is an independent practice. Don't be afraid to ask up front. Sometimes your copays and your coinsurance cost might vary by the location of where you're being treated. Again, the most common differences are whether it is a physician that is employed by a hospital or a physician that is in private practice, because each one of those have different arrangements with their insurance companies, with your insurance company, and the copays and the coinsurance costs may be set differently by those locations. Also is likely to be set differently by the specialty of the physician. The copay or coinsurance that you pay to a primary care physician is likely to be different than the copay or coinsurance you pay to a specialist who might be a medical oncologist or a radiation oncologist, et cetera. You also may get your medications. There may be medication differences. Some may be delivered and dispensed by the physician or the hospital. Some may be dispensed by a specialty pharmacy. Sometimes you have the option of receiving a given medication either from a specialty pharmacy or from the physician or hospital. The copay and the coinsurance requirements can vary widely between those choices. So even when you know which treatments you're going to receive, it's also fair to ask, what are my options and what is the impact to me and on my payment structure if this is being delivered from my physician versus a specialty pharmacy? And now I'll turn it back to Amanda for the next set of slides.
Thanks, Dawn. So when we're talking about these things, choosing your physicians and your facilities, I think we've emphasized, is very important. Make sure your doctors, your cancer centers, your hospitals are covered by your insurance. I think there's several different ways that you can figure this out. It can be calling the number on the back of your card. It can be by asking the registration staff at the facility. And you can also ask them who you may speak to. It could be a billing person. It could be a financial navigator. It could be a financial counselor. But know who is covered by your insurance. And I think with that being said, too, along the way, you may find that you're referred to a surgeon after you've seen your oncologist, maybe for a port or whatever other procedure. And I think along the way, it's important to remember, not just from the beginning, but to also ask when you're referred for those procedures, is this doctor in network? Is their facility in network, depending on if you have to maybe be treated at another facility to see the surgeon. Ask questions about cost of treatment choices. Copay and coinsurance requirements can vary by treatment choice. Ask if there are any services that will not be covered. I think that probably the list of services that are covered is much longer than the list of services that are not. So you could probably narrow that down by asking what is not covered. Are there any exclusions on my policy? There could be something like a medication or a procedure in particular that's excluded. And I think that asking this question up front, if possible and when possible, can help you predict maybe down the road. If you know there's a procedure that you're going to receive, then the treatment facility you've chosen can help you address what you can do to prevent any excessive out-of-pocket cost, knowing that that procedure or service or drug is out of network, or maybe there's an exclusion on your policy. Let your treatment team help you with that. I think in the beginning, asking for a written care plan is very important, and backing up also to what Dawn has said. They're going to give you a lot of materials, and knowing what your care plan is from the beginning to end relates back to your insurance options. Because an example, I had a patient recently who knew since diagnosis that they were going to be losing their insurance. Well, they have the option for COBRA coverage, which is to keep the insurance they have after they lose their job. And one facility was going to be able to help this patient pay the premiums and keep their insurance, versus another facility where they had a second opinion was going to help them with their premiums, but there was also a repayment requirement of those premiums once treatment had ended. So for this person, knowing what that plan was and knowing what their option was, this person did choose the facility that would be able to help them with their premiums. So asking for an estimate also when considering your treatment, a written estimate in particular, if you do get more than one opinion, this will tell you maybe the estimates are the same. So this puts you in a position where you're empowered to pick the facility where you feel most comfortable to receive your treatment. And cost that may give you a little peace and comfort there, knowing that maybe it's just your total out-of-pocket that you know you're going to have to meet regardless of what facility you choose, and you can choose where you're comfortable. Bring someone with you to each visit to take notes and help you with questions. You know, starting a binder from the beginning, if possible, a 3-ring binder, a spreadsheet, whatever you're comfortable with, to write down these questions along the way. I think in the end that you'll go back also to be able to review all of this, and you'll have a complete picture, and it helps your understanding along the way. But having someone with you too, you know, when we sit and talk and have these big conversations about diagnosis, and this is a very serious and overwhelming conversation, you're not going to remember everything that this person tells you. They may have already answered your questions, but writing it down and making sure also, with that being said, that you keep cards, maybe even in the same place, of all these people that you've talked to and how they can help you is very important. But please be empowered to ask questions. Don't be afraid to ask questions. You never know. Your treatment team also, you know, discuss you as a whole to make sure that they're taking care of you all the way around. And I think Dawn also said this too, which I think is a great suggestion. Record your visit so you can review it later. Maybe even you didn't write everything down, so if you can record it and re-listen to it, depending on, you know, how you feel, you might absorb that a bit better. But having this information in advance, everything here about choosing your physicians and your facility careful, is super important. Next slide. So know your insurance coverage. It's important to learn about the specifics of your policy, including what's covered, what's in network and out of network, procedures, doctors, both included, deductibles, what you must pay out of pocket before your insurance company will begin to cover claims. Co-payments, a dollar amount set by your insurance provider required to be paid by a patient each time care or a drug is received. Co-payments can vary based on what type of insurance you have. It could be one copay for your primary care provider. It could be a different copay for your specialty provider, such as an oncologist. And there are also some policies that may have a copay for your x-rays, also your CAT scans. It just depends on the policy. So making sure you ask in advance if there are copays for these different procedures. That's also something that someone could give you in writing in advance. Other out-of-pocket costs to consider. I think by connecting in the beginning with a financial counselor or a financial navigator at your facility, once you know your diagnosis, once you've talked with your physician, and your physician would be a good starting point to find out if that facility has a special person designated as a financial counselor or a navigator to be able to help you determine what other out-of-pocket costs that you may experience. Also, a social worker. Some of these things may be practical concerns and not directly related to your insurance, such as transportation, which I think Dawn mentioned earlier, also child care. There's other medications as well. If you already have a chronic illness, maybe that your new diagnosis might affect that. So they can help you plan for other out-of-pocket costs that may not be directly related to your cancer. A social worker as well, maybe your utility bills. Maybe that's something that needs to be addressed. Maybe if you're not working, what about food and necessity for that while you're going through treatment? So those other things. How best to use your insurance benefits. So when we talk about this, I think as you're going through your journey with your physician, I think this time of year is a perfect time of year to talk about this, because if you have met your deductible and out-of-pocket already for this year, let's say 2017, you have a scan, such as the CT scan for some sort of follow-up scheduled in January, it's okay to ask your physician if that can be moved to December. Sometimes it's okay. Sometimes the physician will approve. Sometimes maybe they have a different preference. But I think that it's important to involve your physician when making those decisions and explaining to them why, and then they can plan your care to have your scans at the end of the year, and then your treatment at the beginning of the year will probably consume your deductible and potentially your out-of-pocket. And at that point, if you're under any type of financial assistance, or maybe there's grants for your treatment, then your treatment is potentially covered by that grant money versus your scan consuming your deductible and your out-of-pocket. So things like that to consider strategically about how best to use your benefits throughout the year. Do you have questions about your insurance? You can call the phone number listed on the back of your insurance card. There's also staff located in the facility that can direct you to a person or to someone, a financial counselor again, or a navigator that may be able to help you better understand your benefits. There's also online portals typically with your insurance that you can tap into. So you can use your website. You usually can set up a registration, and you can see your insurance benefits through your portal. This would include your explanation of benefits also, so you could monitor those claims coming through. Next slide. Review insurance coverage. Some insurance plans may offer low premiums but provide limited coverage for cancer treatment and cancer drugs. Ask questions before choosing an insurance plan. What will you pay for? Are there limits for what is covered? I have a patient who recently started treatment, needed both chemo and radiation. His insurance paid for 2 days of radiation, but he needed 8 weeks. And it covered 0 chemo treatments. It did cover hospital stays and some other limited benefits, but this patient was essentially uninsured. So very important to know what your insurance covers. And just because it has a low premium does not necessarily mean it's a limited benefit plan, but definitely something to consider when you're choosing an insurance. Ask which doctors, hospitals, labs, tests, x-rays, or medications will be in-network or covered before choosing them. Is there a better insurance plan for me? This is a question I think that anyone with insurance could potentially consider, when is open enrollment? Do I qualify for a special enrollment period? A special enrollment period is defined by a life event, a birth of a child, adoption, divorce, marriage, job loss. So a major life event could trigger what we consider an SEP, which is a special enrollment period that would allow you to enroll in insurance outside of what is normally set as an enrollment period. There's also, for some people who have insurance, the yearly enrollment period that rolls around. You can choose a different plan that may better fit what your situation is now versus what it was a year ago. So something to consider there. We have multiple enrollments. We have Medicaid enrollment. If you have Medicaid insurance and your managed care organization, maybe they're not in network with your providers. So you can call, there's hardship exceptions. If you are getting treatment for a chronic illness and you're having a hardship exception because none of your providers that are close to you are in network, that can be an exception for a special enrollment. Also, for Medicare Advantage patients, enrollment also can be a special enrollment if you have a 5-star plan. People who have a 5-star plan can change their Medicare Advantage plan at any point during the year. And I think that this is why, again, to stress that it's really important to talk to someone at your facility that may be able to give you these tips and these tricks to help you optimize your insurance based on what your current situation is, and also considering your future situation and the future picture of your treatment plan. Next slide. And Dawn is going to go over questions to ask your insurance company. Dawn?
Okay. So when you're speaking with the insurance company, it's always a good idea to have a pad and paper with you and a pen so that you can take notes as they're telling you these answers. It also is a good idea to ask the person's name, ask their role within the company. They may be the frontline person. They may be a second-line medical benefits person. It's useful to know who you're speaking with, because later if you go back and you say, oh, this is what I understood, someone else may say, well, who told you that? Because that is or isn't the case. So some of the questions to start with, and what I would do is just copy down these questions from the slide deck when you have a chance to look at it. There also can be other resources available that could give you this list as well. So ask them, what isn't covered? What are their exclusions on my policy? Many insurance companies have carefully looked at what they think should be covered and what they think should not be covered. Sometimes they will determine that something is still experimental treatment, that it has not got enough evidence to satisfy them that this should be the standard course of treatment. So they often will have discussions back and forth with your physician, even about a specific choice of treatment. What kind of counseling and supportive services, like nutrition and social services, are covered? These are very, very important services, because on the one hand, you have the clinical treatment. You're getting the drugs. They're making sure you're getting those drugs in your body at the right time with the right way. But you also have to continue living. You're going home to a certain environment. It may well be that you have support system, or maybe you need a support system. You may have people that you're responsible for. You may need help with that. You're going to need to decide, what am I going to put in my body? What am I going to eat? And how is that going to change? Your taste may change. You may need more salt, more sweet, less sweet, because your body is reacting to things differently. So nutrition and social services are very important. It may seem funny to say, I've got cancer, why am I talking to a dietitian? It's all part and parcel. It's not only the nutritional value of what you may want to put into your body, it's also whether that's even going to appeal to you, or how to make food appeal to you, et cetera. Also ask the insurance company, are there limits to how much they will pay for the year? Now, Amanda did mention, and the bad news about cancer care is that it's costly. The good news about cancer care is that it's costly, and if you have chosen an insurance plan that has a deductible or an out-of-pocket limit that you are comfortable with your financial situation, you may hit that very early. You may even hit that in the first month of the calendar year, in which case then you probably have coverage for most of the rest of the months of the year without worrying about the deductibles and the co-pays and the co-insurance, et cetera. So if there's a silver lining or a gold lining to having cancer, that is one of them, because once you know what those limits are, you may get a better sense of confidence and a better sense of peace when you're talking to your physicians about what this calendar year is going to look like financially for you, as well as what it's going to look like medically. Sometimes there is a term that has been used that it's a limit to what the insurance will pay for the whole policy. Now, many of the Medicare, many of the exchange insurance plans are limited and cannot offer a lifetime maximum, but there may still be some insurances out there that do have that. So you may have an annual maximum, but it's important to ask. Likely there won't be, but it's important to ask, is there a lifetime maximum? Sometimes that would have been a cap of X million dollars or X $100,000. It probably doesn't apply to you, but it's very important to ask to find out. And what does the insurance plan say that you have to pay for each visit to the doctor? And recognize that that copay, that's what you pay for each visit, may be different for your primary care doctor versus the specialist, or to the emergency room or to the hospital. And when, as Amanda has said, when you're determining where you're going to get treatment, do look at the combination of copays and coinsurances and the coverage, because it may make a significant difference to you. It always will benefit you to avoid going to the emergency room. If you go to the emergency room, the costs are usually more significant, and the likelihood of being admitted is much higher than if you seek a way to manage your symptom or what is concerning you with your doctor's office. What does the insurance plan say that you have to pay for each cancer treatment? It may differ from radiation to chemotherapy. They may say some lab tests are covered, and they may say some others are not. But it may be a test that you and your physician feel are important. So then you would have to have the discussion with them about, well, my insurance isn't covering this. Isn't important enough that I want to make sure I'm covering it myself out of pocket. It does not go for your out-of-pocket maximum, because the out-of-pocket maximum is for services that the insurer has deemed are coverable and appropriate. So you're completely on your own if you're doing something that your insurance company is not deeming that they will ever cover any piece of it. So it's important to know that. And that goes back to the insurance limits and rules about cancer drugs as well. There are different payment rates, whether the drug is provided through the physician versus the specialty pharmacy. Every cancer drug pretty much is on what most insurers would call their higher tier or their specialty tier. That usually has the highest copay and coinsurance amounts. But again, remember the good news, bad news about cancer. The good news is even if there are higher amounts, you may hit your maximums early, like in January or February, but once you're done with them, you're done with them. Will your insurance company make you get the drugs that you need from a certain location? They could say this drug has to come from this specialty pharmacy. They're less likely to say this drug has to come from your doctor. But just be aware, because when you go to a specialty pharmacy, they collect their copay and coinsurance, and they often are, how shall I say it discreetly, more aggressive about that than perhaps the physician or hospital may be. Often you will be asked to provide your copay or coinsurance when you go into a medical office for treatment, but they are very willing to work with you and make payments and whatever it takes for you to be able to handle all that. If you go to a specialty pharmacy, it's more like a corporate business, and you're more likely to receive an expectation that you're going to cover your copay or coinsurance before the drug is ever dispensed. Also ask the insurance company if they have a cancer case manager that could help you. These are folks that are there to help guide you across the care continuum, help recommend to you which physicians or hospitals or types of treatment may be in network or out of network. They're there to help you understand what your expectations, responsibilities, and benefits are through the insurance company. So let's go on to the next slide. Screening and wellness programs. The best way that you can reduce your cost of cancer treatment are to be aggressive about your health and about managing your risks for cancer before you ever get diagnosed with cancer. Learn your risks. If you or your loved ones one of you may have cancer, the others may not yet, so they can take a look at what their risks are. Try to catch them early. The earlier we catch cancers, usually the more affordable it is to manage them, and the faster we can manage them and keep them from becoming more significant. If you're already dealing with cancer, you may have an increased risk for developing other cancers, so that's an important question to understand. Screening and wellness programs are very, very useful. Education and information is very useful. The only caution I will give you is that there is good information and there's bad information. And just because it's out on the Internet doesn't mean that it's right. And so always try to be very careful about the sources that you're looking to for this information, and feel free to reach out to people like the cancer support community and to your physician offices to try to separate the wheat from the chaff. Take a look for screening and wellness programs. As you're reading the paper, you may see prostate cancer screening being offered somewhere, or breast cancer screening, or a mammogram. Do take advantage of those. Some people may feel that what they don't know can't hurt them, but I tend to believe that what you don't know, and that doesn't give you power over choices and decisions for your body. So let's go on to the next slide. Stay on top of your health. This is whether or not you're in the middle of your cancer treatment. Take care of yourself. Listen to your doctor when they say, these are nutrition things that you need to add. Listen to your doctor if they say you're going to need more sleep than you usually do, or you're going to have to stop and rest. And I'm just as guilty of that as anybody. But when you take care of yourself, your body can fight the cancer better. Look for changes in your health and how you feel. Your doctors will tell you, with this drug, with this treatment, this is what may happen. Some of those may happen are more likely, some are less likely. Sometimes the doctor will say, watch your temperature. If it goes up even 1 degree, call me. Don't be afraid to call the office. Usually the oncologist offices are covered on a 24/7 basis, specifically for the ability to help you when something seems wrong, because you know your body more than anybody else. Don't be afraid to call them. They may help you avoid a hospitalization or an emergency department visit. They may put your mind at rest and say, try some ice chips, try this, and we'll bring you in tomorrow and we'll take care of this for you. So don't be afraid to remember what they say. Use your binder that Amanda suggested you put together. They will tell you what to watch for. They will answer questions when you have them. You're the best person to know what's going on in your body. Trust yourself, trust your body, and do what you can to help. So if you're looking at the binder and if you're thinking and listening to your body, you'll know when to call your physician, and don't wait till the last minute. They'll usually tell you if you're seeing this symptom and it happens twice in a day, 3 times in a day, that's the time to call us, etc. What you're trying to do is not only to make yourself feel better, but you're trying to avoid the cost of those emergency visits and hospitalizations. Talk to the doctors and nurses about other health issues. You can aggravate your whole body system if you have other comorbid conditions like diabetes or heart problems or high blood pressure, low blood pressure, and you don't stay on top of that during your cancer treatment too. Ideally, you'll be your primary care physician or the person treating those diseases, those symptoms, are going to be in touch with your cancer physician so that they all know that this is the situation that you're in right now, and they're all going to do what they can to help you get through it. But ultimately, it comes down to you because you are the common denominator between all those doctors and nurses. You know what you've got, and you know how to listen to your body. So let's go on to the next slide. Stay organized. It's good. Your thought process may be a little bit slower. It's not an accident that they talk about chemo brain, and you may not always have at your fingertips or at the tip of your tongue what you're thinking about and what you want to do. This is the time to get yourself organized and to use the tools that are available to keep you organized. You will have a binder. Keep that binder full of information about your treatment. Make a folder, and every single time you get one of those EOBs from your insurance company or a bill from your healthcare provider, put it in the folder so you can keep track of what you've been doing, what you've been paying, and what your total costs are. Also, request and store a care plan from your physician. Keep your medical advice in one area so you can quickly flip to it, because you may not be seriously listening when they talk to you about feeling hydrated or dehydrated. And yet when you get home and you start to say, oh, shoot, what did I do in this circumstance? If you've got it in the file, it's easy to flip to it and say, oh, okay, that also makes you less worried. You have control over this stuff. You have control over managing where you're going to get your treatment and your cost, but you also have control over these choices and this follow-up. All of this will happen if you keep everything in a folder where it's readily available. Keep copies of your test results and your symptom and your drug information and your insurance plan. You go to another doctor, they're going to ask you, did you have this test? Did you not have this test? Yes, they can ask your doctor, but if you have the information readily available, they're not going to do a second test on you unless it's appropriate for your treatment to know if something has changed. So you can help control redundant testing by knowing what's already been done for you and where and who did it, so that if somebody said, I think you need an MRI, you would have the information. I had an MRI 2 weeks ago, and the information is at this office. Make a contact list, a cheat sheet for yourself of who in your doctor's office you're going to call, what are the names of your doctors, which hospitals and which facilities are you getting care from, what are their phone numbers, who have they told you to call when you need something. Also for your insurance company and the pharmacy or anybody else, if there's a social worker that's giving you guidance and advice, or a dietitian, or a caregiver or something like that, or somebody in the cancer support community. Make notes when you talk to somebody. We already talked about making a note when you're talking to somebody at the insurance company. Who did you talk to? What is their job title? What is their phone number? So that if you ever need to question what you were told, you can go back and you know exactly where you got it from. Include their date and what they said. You also worry less the more information you have available at your fingertips. This is, again, a way to take control of this whole situation. May we go on to the next slide, please? Keeping track of your finances and your bills. I would set up a financial folder in addition to these other folders that you have. And these don't have to be expensive folders. Just grab a manila folder. They're not very costly, and they are so valuable in terms of what they will give to you in helping to keep yourself organized. Or just a big envelope, whatever you have available, just whatever works for you to help yourself keep organized. Keep records of your bills, and you may want to have a pad of paper, because some of the things that you spend related to your cancer you might not think are important, but at the end of the year when you're doing your taxes, you might find out that they're tax deductible. So what service did you get? What did you pay, and what did you pay for? What did the insurer pay, and or somebody else? There may be a foundation that has contributed money to cover some of the cost. You're going to want to track and say, oh, and by the end of the year, you might say, wow, I got $5,000 worth of support from this organization. And that's important. It's going to make you feel better and more supported, et cetera. Mileage. When you drive for treatment back and forth, some of those costs might be tax deductible. So that's an important, and once you figured it out, from my house to this treatment facility, maybe 31 miles, then you can just repeat that each time. You don't actually have to calculate the miles each time. Ask for the EOB from your insurer when they pay claims. You should get that automatically in the mail. But if you don't on a regular basis, you should ask for it. And make sure that there's a lot of choices between paper bills and electronic bills, and I just prefer to ask always for paper. So whatever process you have to do that you're comfortable with, just make sure that the insurer is sending you a copy of the EOB every time something is billed to them. That way you can also double check and make sure, well, you should have received this bill for this x-ray and it showed up or it never showed up. Also, by keeping track of all of this, and if an insurance claim is denied, that gives you the basis for an appeal for challenging the denial about whether this is appropriate or not. If you have to challenge something from your insurance company, there are people within your doctor's office that can help you. They may have a title of a financial counselor, a financial navigator, a billing counselor. Could be a number of different choices. But you can always bring your bills in there and say, I just don't understand this piece. Help me figure out how this fits. So if you aren't getting the answers you want from your insurance company, turn to your doctor's office. They may be able to help you as well. Now let's go on to the next slide, and I'll turn it back to Amanda.
Thanks, Dawn. So we can't stress it enough. Don't be afraid to ask for help. You can find help in many places, including your insurance company, doctors, hospitals, family members and friends, and local support groups. Some of these people may be called care managers, financial counselors, patient navigators. Regardless, don't be afraid to ask. Contact the Cancer Support Helpline via phone or our website here. It's a toll-free number, and we're available Monday through Friday, 9 a.m. to 9 p.m. I can't stress enough that sometimes you may just need someone to talk to, and don't be afraid to ask for help. Go on to the next slide, please. Seek help from foundations and programs. Call foundations or assistance programs to learn what help is available. So you may or may not know there are many foundations out there. You may see them on fundraisers. You may see them across the internet. But these foundations are there to help you with your cancer treatment. They're there to help you with your out-of-pocket costs, so your deductible, sometimes your co-pays, and then again, the total out-of-pocket you would pay towards treatment. It's specific to treatment. They're also specific to do your diagnosis. So that's, again, very important, why we need to know this information up front, to know how we can help you or how you may be able to help yourself. When applying for help, clearly write all the information down requested. Include all the information from your doctor's office. It is an application process for each one of these foundations. So regardless of it be you seek it out for yourself through research on the internet, maybe through the information we provide for you here today, maybe through your doctor's office who may have connection with the foundations. They should be able to help you. Also, don't be afraid to ask for help. Let a physician know if they must sign for you to receive help. That's usually part of the application process. Make sure all of the information is correct, address, phone numbers, etc. Keep copies of all completed forms for your records, very important. Depends on if you fax or email. Regardless, electronic transfers can get lost. Submit information on time if there's a deadline. Sometimes there isn't an option for retroactive assistance. If a form affects your drug refills, submit the form early enough that it can be processed to keep your refills on time and not delay your care. Let your doctor's office know what you're doing with the foundation or assistance programs. They may also want to keep your information on file. Some facilities also have a process for this. They will help you file your claims. So again, very important to keep your physician and their staff involved. Next slide, please. So here is a list of those helpful organizations. Some of these organizations are tools to help you with your cancer treatment, with estimates, with your insurance, tips and tricks. Some of these are foundations that will specifically help you with your cancer treatment. We actually have 2 slides here that we're going to fill you full of. Here's the second slide. The Extra Help Program is something that it's a program that the Social Security Administration will help those who have Medicare coverage for their prescription drug costs. It will help lower your copays and in some instances even eliminate your premiums for your drug card. Healthwell Foundation, Leukemia, Lymphoma, National Organization of Rare Diseases, Need Help Paying Bills, Needy Meds. Needy Meds is a search engine. Needy Meds is a great place to start. Needy Meds is a website that you can plug in your diagnosis or the specific medication that you might receive for treatment, and it will tell you which foundations might be able to help you. So really good place to start. RX Assist, listed towards the bottom of this page, is another one of those, and those are not the only sites that are search engines that will help you with searching for foundation assistance.
Thank you, Amanda and Dawn. I would also like to remind our listeners that all of these questions, all of these resources are available at www.cancersupportcommunity.org/cost. The Tips for Managing Cost of Care booklet that is coming soon has these lists of questions, as does our Coping with the Cost of Care book. We would now like to open the discussion up to the audience. We may have answered some of your questions during the presentation. However, if you have any additional questions, please feel free to type them into the Q&A box that you can see near the bottom and right side of your screen. So the first question that I'm going to ask, I'm going to direct to Dawn. Someone says that they don't understand the difference between copay and coinsurance. Can you explain the difference, Dawn?
Yes, a copay is usually a fixed dollar amount. So every time you walk into your primary care doctor's office, that may be $25, or to your specialist office, it may be $40 or $10. Coinsurance is a percentage of the cost of the treatment. So and coinsurance is quite often applied to drugs. So they would say that you are responsible for 20% of the cost of this drug. So if the drug costs $200, then your 20% would be $40. If it costs $2,000, then 20% would be your $400. And so when there is likely to be a variable cost for whatever the treatment is, the higher likelihood is that you may have a coinsurance for something specific like a doctor's visit or each time you go into the ER. That's more likely to be a copay.
Great, thanks. I'm going to follow this up and ask Amanda to answer, will my doctor or my insurance company able to tell me what to expect in copay or coinsurance before I start a procedure or get a therapy?
Absolutely.
This person is not getting straight answers and is confused who might be able to answer that for them.
And most of the time it's not the physician. It will be someone in the physician's office. You may try asking the physician's nurse or even the registration staff who you could speak to about an estimate. But yes, absolutely. And I would actually request that in writing. They can sometimes even print out your insurance benefits that directly come from your insurer to explain what copays you're responsible for, what coinsurance, but the entire breakdown of the insurance. So yes, I would definitely ask for that in a written
Dawn,
form.
if I could add though that sometimes they may not know because I'll give you an example. A physician may say, this is the treatment plan. We're planning to give you these sort of drugs on 3 weeks on, 1 week off, but every time you come in for treatment, they're going to take a look at what your health status is. And sometimes you may not receive the exact dosages and the exact drugs that the physician had thought he was going to be able to treat you with. When that happens, that's going to be variable. And so he may say it's going to be these drugs over this period of time, but it may actually change based on your health status at the day of treatment.
Absolutely.
So some of the variability may be related to that.
Thank you. So here's a question. I lost my job and the COBRA payments are so high I can't afford them. Can I switch to an ACA plan outside of the normal enrollment period? Dawn, can you answer that?
I haven't run across that specific situation. You had a life-changing event when you switched to the COBRA, and it may well be that the insurance in your state says that you can't choose another life-changing event unless something else happens. If there's a dramatic financial change and it's the cost of the COBRA, maybe that will trigger another life event that does let you into a special enrollment period. One of the things you can do is work with your physician, because sometimes there is help to cover and to help you cover premiums that you can't afford. So that's another option. Don't forget to check that one out as well.
And so if this person hasn't started the COBRA payments, if they lost their job and the COBRA payments were so high that they haven't moved to COBRA, can they switch to ACA now?
You have 60 days. Loss of job is a life-changing event, and I'd like to reiterate what Dawn said. It could vary state to state, but it should actually address this in the COBRA paperwork, and I would suggest that you do look at the COBRA paperwork packet. But 60 days from the time of job loss, you do have the option to choose an ACA plan, and you should have also 60 days to choose if you want to elect COBRA or not.
Thanks, Amanda. The next question is it possible to go on a payment plan for expensive procedures or prescription drug costs? Amanda?
That's a fantastic question. So each facility may vary with their requirements and what they offer as far as payment plans, but most facilities will offer a payment plan, and even some offer extended payment plans. Some of this can possibly involve interest, whereas others would not. So I would make sure that you ask that question when speaking to the facility. But yes, most facilities do.
And this is Dawn. I would just add a variable that if you are required to have specific drugs from a specialty pharmacy, there may be less flexibility with payment plans.
That's a great point, yes.
Thank you. So, Dawn, there are a couple questions about Social Security disability insurance. And I'm going to start with this first one of just under what circumstances can I apply for Social Security disability insurance?
The federal government does a really good job of laying out those parameters. Sometimes it's hard to find, so everybody's situation is going to be a little bit different. So what I would do is I would say I would defer back to what the federal government's parameters are. But if you are having a hard time finding them, I would Google. That's my favorite tool. And I would Google, when can I start disability with cancer or something like that. And just see what comes up, and or with Medicare or Social Security disability, and see what comes up, because it may take you directly to the page where the government has already given a frequently asked questions section that may cover all the different parameters that could affect you.
I'd like to add to that too. The Social Security website does offer even a calculator to help you calculate what your Social Security might be based on your years of service, your years of work. So that's definitely a wonderful tool as well. And there's also, if you Google this, and it is on the Social Security website, it's called Compassionate Allowances. The Compassionate Allowances list has a variety of cancer diagnosis and other serious diagnoses not related to cancer that are potentially fast-tracked for a Social Security disability approval.
Thanks. So I'm going to follow that up with a question from someone who was approved for SSDI but is not eligible for Medicare due to the 2-year window that you have to wait after being approved. They're kind of confused about whether this is a government rule and how they expect people on limited income be able to afford health care and health premium costs. Are there any solutions out there?
I don't know about solutions, but I will say that that is a federal rule. It's 2 years and 5 months from the date that you were deemed disabled. I think that an ACA plan is not an option due to affordability based on a fixed income. There's definitely other things you could potentially layer in there, and I would suggest working with the facility to see if financial aid may be an option now that you are on a fixed limited income.
That was a great answer, Amanda. I don't think I can add to that.
Thank you. So here's a question from somebody who says that they have a large bill, a large hospital bill, that they have reached out to some local resources for help with payment, and either they don't cover their specific cancer or that payment source is out of funding. Do you have any suggestions for help with copays and help with medical bills?
Well, this is Dawn. My suggestion would be to go back to the Helpline, which was on the last slide. Try there. Also try the hospital, because they know what the support systems are in their geography. Chances are they know which ones are running out of money. Chances are they even know that this one may run out of money 2 days into the month, whereas this one manages their disbursements so that they still have money towards the end of the month. So there are other people. Reach out to the people that are used to looking for these answers for a lot of patients, and they should be able to help you with your situation.
I'd also like to add to that, some people may not initially qualify for financial aid with the facility. However, a lot of facilities, if you go back and ask for a reconsideration, they have a different financial aid program that is called a catastrophic program. So if it just depends on a lot of times versus your income versus the amount of debt you have at this point from your treatment as to what catastrophic would be for you. But I would definitely suggest going back to the facility with that question as well.
Great. And then in terms of non-medical related expenses, is there help with things like food, rent, babysitters, that kind of assistance?
There was one particular website that was listed on the last couple of slides there. It's needhelppayingbills.com. It's a pretty practical website that lists state to state what programs maybe out there for utilities, for rent, for mortgage. And there's a lot of state-specific programs, so I would suggest starting there as a search engine. But again, back to what Dawn said a moment ago, please reach out to our helpline as well if you have questions and needs in that area.
Great. Here's one more question. What is the definition of medical bankruptcy? And if I file for medical bankruptcy, will I lose my credit?
Amanda?
I'm not sure that I have an answer directly for that, but I would suggest potentially reaching out to an attorney. Normally there's not a retainer fee initially, just for advice to see if that is a possibility for you and how that would affect you.
Great, thank you. And then there are a couple questions about Medicare plans. One patient is saying that their oncology practice is no longer taking Medicare patients. What should they do in this situation if they are on Medicare?
That's a challenge. This is Dawn. As insurers are becoming more and more concerned about the cost of medical treatments, not just cancer care, they are putting restrictions on the providers. Sometimes they will tell a provider, we're not going to include you in our network. Sometimes they will tell a provider, particularly Medicare, this is how much we are going to reimburse you. It doesn't matter what your costs are. This is how much we can afford to pay you. And if the provider is caring for so many of those patients, they probably would not remain financially viable or open for all of their patients if they accepted those rates for everybody. That's usually the case when a physician or a provider decides to not accept Medicare any longer. It is a significant choice for them because it's not something you can opt in and out of very quickly or easily. So most physicians tend not to take that step unless they really have to. Your only choice then, if they are not accepting Medicare and if Medicare is your insurance, you will need to look for a different provider.
I'd like to add to that also and maybe speak with your physician about managed care Medicare. Maybe they would accept a Medicare Advantage plan, a specific product of it. I'm not sure, but I think it's worth asking the question.
The managed care Medicare packages and insurance plans tend not to be very supportive of somebody who's going through cancer. When you have a managed care Medicare, they tend to put the cancer drugs up in the highest tiers, and they tend to be, I tend to see them being more aggressive about putting some providers in network and not in network because they are operating more as a commercial for-profit type of insurance program. And if you have a managed Medicare program, it will be very important to check and see who is in network, who is not. Sometimes, and in some markets, I will tell you, at least in our geography, there is a major academic health center that most people would think, I'm going to go there because they may have the most advanced treatment, rightly or wrongly. No managed Medicare patient can go to that facility in network. They've just decided, no, it's not in network. So look very, very carefully if you have cancer and you're considering a managed Medicare plan. Most of the time, I tend to have seen patients that have decided that that was not going to be the best choice for them. So just keep your eyes open if you're looking at that as an option.
Well, that information segues nicely into the next question of how to select the right Medicare plan or supplemental Medicare insurance if you are a cancer patient. Do you have any more tips for selecting Medicare plans?
I'll start, and one is take a look at the providers that you think you're likely to be turning to, and ask first, are they in network or are they not in network? Then it doesn't hurt to call some of the providers and say, or even ask even if you have a physician and you already have a relationship with a physician and they know what type of cancer you have, it doesn't hurt to call up and ask them, with this cancer, what is the experience of other Medicare patients? Is the coverage going to be here? Have they excluded a certain drug that would be likely best practice treatment for me? Do they mandate that the drugs be delivered only through specialty pharmacy, which may be a higher cost or not, I need to figure it out, than obtaining them through my physician? Managed Medicare plans have more control over the choices and the options available in a benefit plan than traditional Medicare. The other factor that I would add to this is if you have chosen a managed Medicare plan, you do not have the option that you have under traditional Medicare to take out supplemental insurance to help cover the cost of the 20% that Medicare expects you to pay. That supplemental insurance is not available to managed Medicare market beneficiaries. That's another wrinkle that you're going to want to add into your consideration.
I'd like to add to that too, and stress what Dawn just said. Call your providers to ask if they are in network. I think that probably calling your provider may have more up-to-date information versus the list of providers that the insurance has. I think they change often, so I'd like to stress calling your provider is probably the most reliable method. Also, medications. If you're choosing a Medicare Advantage plan and you use the online tool, which is on Medicare.gov, that tool will allow you to enter your medications, which will show you the plans that have the best tiers, so the best coverage and the best copays for the medications you may already take. So I would take that into consideration. And then a very, very important tidbit of information here for the cancer population of people. When you turn 65, or from the time that you receive your Medicare Part B, B as in boy, you have 6 months to choose a supplemental plan, and you will not be put through medical underwriting. Therefore, you may not pay those astronomical premiums because you have a pre-existing condition. So that pre-existing condition is waived for the first 6 months from either A, the time you turn 65, or B, from the time you start receiving your Medicare Part B as in boy benefits.
And are some of the tips that you gave about choosing a Medicare plan applicable if you are enrolling or renewing ACA coverage? There's a patient here who said that they used to get help locally in choosing their ACA plan, but that help isn't available anymore.
Yes, you can. You can plug in your providers to see if they are in network. Again, I would like to stress that calling your providers, if you already have established doctors that you see, would probably be the most reliable. Those ACA plans, when you're choosing them, they have plan names, so that's what I would use to call your providers.
Great. I have one more question. This is a patient who is needing additional surgeries due to a doctor not completing the surgery as specified prior to surgery, and they're trying to figure out if they're still responsible for copay costs for these follow-up surgeries.
That would be a unique discussion that you would have to have with both your insurance company and with the physician who did the initial surgery. It's not something that there is a standard answer for.
Okay, well, we are getting close to our ending time. I just want to check and make sure there isn't one last question. And I will give about 10 seconds to see if one last question comes in. I really want to thank our wonderful panelists, Amanda Holt and Dawn Holcombe. They contributed their time and shared some very important information with us. So we definitely appreciate that.
Thank you, Claire.
We're happy to do it.
You're welcome. Cancer support community would also like to thank our program supporters, AbbVie, Genentech, Celgene, and Takeda Oncology. Please take a moment to complete our webinar evaluation survey, which you will be automatically redirected to. We greatly appreciate any feedback you may have. Thank you for your participation and have a wonderful evening.